Essential oils have become a staple in wellness routines around the world. From diffusers filling living rooms with calming scents to bath bombs promising spa-like relaxation, these potent plant extracts are often marketed as natural solutions for a variety of ailments. In recent years, some have even claimed that essential oils can be used for intimate care, including vaginal health. But does this trend make essential oils a vaginal superhero? Or are there hidden dangers lurking beneath the surface? Let's explore the science, the hype, and the potential risks of using essential oils for vaginal health. To begin, it's important to understand what essential oils are and how they work. Essential oils are concentrated liquids extracted from plants, capturing the scent and flavor, or essence, of their source. Common methods of extraction include steam distillation or mechanical pressing. Each oil contains unique chemical compounds that give it distinctive properties. For example, tea tree oil is known for its antimicrobial qualities, lavender for its calming effect, and peppermint for its invigorating aroma. These properties have made essential oils popular in aromatherapy and alternative medicine circles. When it comes to intimate health, some proponents suggest that certain essential oils can be used to address vaginal issues such as odor, dryness, infections, or discomfort. You might come across recommendations for diluting a few drops of tea tree oil or lavender oil in a carrier oil and applying it to the vulvar area, or even inserting essential oil-soaked tampons for supposed benefits. But are these practices backed by evidence? And more importantly, are they safe? Let's look at the claims. First, the idea that essential oils can treat vaginal infections, such as yeast infections or bacterial vaginosis, is rooted in the antimicrobial properties of some oils. Tea tree oil, for instance, has demonstrated antifungal and antibacterial effects in laboratory studies. Lavender oil and oregano oil also show promise in test tube experiments against certain pathogens. However, the leap from lab research to safe, effective use in the human vagina is a big one. What works in a petri dish doesn't always translate to a complex human body, especially in such a sensitive area. The vagina is a self-cleaning organ, protected by a delicate balance of bacteria, primarily lactobacilli, and a specific pH level. Disrupting this balance can lead to irritation, infections, or more serious complications. Introducing concentrated plant extracts, which are highly potent and sometimes irritating, can upset this natural equilibrium. Essential oils are not regulated by the FDA for purity or strength, and their effects on the vaginal microbiome are not well studied. In fact, many gynecologists caution against the use of essential oils in or around the vagina. The mucous membranes in this area are highly absorbent and sensitive, making them more susceptible to irritation and allergic reactions. Essential oils, even when diluted, can cause burning, redness, swelling, or allergic dermatitis. Some oils, such as cinnamon or clove, are especially irritating and can cause chemical burns. Even purportedly gentle oils, like lavender, can provoke reactions in some individuals. It's also worth noting that the safety of essential oils varies depending on the source, concentration, and method of use. Applying a drop of essential oil to your skin is not the same as inserting it into your body's most sensitive tissues. Many essential oils are recommended for external use only, and most manufacturers explicitly warn against internal application. Unlike pharmaceutical drugs, which undergo rigorous testing for safety and efficacy, essential oils are largely unregulated. This lack of oversight means there is little to no standardized information on safe dosages, especially for internal use. There are additional concerns for certain populations. Pregnant or breastfeeding individuals should be particularly cautious, as some essential oils can cross the placental barrier or be transmitted through breast milk. Oils like sage, rosemary, and clary sage, for example, are thought to stimulate uterine contractions and are generally not recommended during pregnancy. Moreover, individuals with underlying health conditions, allergies, or sensitive skin may be at greater risk for adverse reactions. Despite these risks, the allure of essential oils as a natural remedy persists. The idea of harnessing plant power to solve intimate health issues is certainly appealing. But it's crucial to balance this appeal with scientific rigor and a healthy dose of skepticism. The absence of robust clinical trials examining the safety and efficacy of essential oils in vaginal care should give consumers pause. Without this evidence, it's difficult to know whether these products are truly beneficial or potentially harmful. Some individuals report positive experiences using essential oils for vaginal health. They may describe relief from symptoms like itching, odor, or discomfort after using diluted oils externally. However, these anecdotes are not substitutes for scientific evidence. The placebo effect, where simply believing a treatment will work leads to perceived improvement, is well documented. Additionally, short-term relief does not guarantee long-term safety. If you're considering using essential oils for vaginal care, there are some important guidelines to follow. First, never use undiluted essential oils directly on your skin, and especially not on mucous membranes. Always dilute essential oils in a neutral carrier oil, such as coconut, almond, or jojoba oil, and perform a patch test on a less sensitive area of skin first. Even then, remember that what's safe on your arm may not be safe for your vulva or vagina. Second, avoid inserting essential oils or oil-soaked products into the vagina. The internal environment is far more sensitive than external skin, and the risks of irritation or infection are much higher. If you experience any burning, itching, redness, swelling, or abnormal discharge after using a product containing essential oils, discontinue use immediately and consult a healthcare provider. Third, be wary of pre-made products marketed for vaginal health that contain essential oils. Even products labeled as natural or doctor-recommended may not be safe for all users. Check for ingredient lists and look for products that have been tested for safety and efficacy. When in doubt, consult a gynecologist or qualified healthcare professional before trying new intimate care products. It's also helpful to remember that the vagina, for the most part, does not require special cleaning or fragrant products. Regular bathing with water and mild unscented soap for the external genitalia is usually sufficient. Overuse of scented products, douches, or essential oils can do more harm than good by disrupting the vaginal microbiome and natural defenses. For those seeking natural solutions for vaginal health, there are safer alternatives to essential oils. Proper hygiene, wearing breathable cotton underwear, avoiding overly tight clothing, and maintaining a balanced diet can all contribute to vaginal wellness. Probiotic supplements, particularly those containing lactobacilli, are being studied for their potential to support vaginal flora, although more research is needed in this area. If you are experiencing persistent symptoms such as itching, odor, or discharge, it's important to seek medical advice rather than self-treating with essential oils or other home remedies. In summary, while essential oils have a fascinating history and a variety of uses in aromatherapy and skincare, their role as a vaginal superhero is unproven and potentially risky. The sensitive nature of vaginal tissues, the lack of regulation and research, and the potential for irritation or allergic reactions all make essential oils a questionable choice for intimate health. Rather than relying on trending natural remedies, prioritize evidence-based care and consult with healthcare professionals for any concerns related to vaginal wellness. The world of essential oils is rich with tradition and potential, but it's also filled with myths and misunderstandings. When it comes to your health, especially such a delicate and important aspect as vaginal care, erring on the side of caution is always wise. Essential oils may be superheroes in some contexts, but in the realm of vaginal health, their powers are not only unproven, they may even be a hidden danger. Seek balance, trust science, and treat your body with the respect and care it deserves.